This film shows the different thoracic movements of breathing during Schroth's three-dimensional scoliosis therapy. In preparation, one has to correct the faulty balance of the scoliotic body, which can be seen left on the first picture of this patient. One has to start with the correction of the pelvis. The patient tightens hard the muscle chain from the left upper thigh to the pelvic crest and moves the pelvis, which being in a false position to the left outer side to the center. The body elongates and remains there while the movement of the breathing occurs cranially and laterally in the left concavity in an imagined right angle. This movement of breathing is combined with a mental effort to lower the diaphragm. By doing this, the patient obtains a more stable middle of the body, which prevents the thorax from collapsing. Here is demonstrated how the displacing of the pelvis to the front causes an unfavorable influence on the higher parts of the trunk. Therefore, the pelvis has to be turned dorsally. This is the first correction of the pelvis. This correction of the pelvis will always be combined with the second one. This is the tilting of the pelvic crest in the front to correct the lumbar lordosis. The tilting and straightening of the pelvis will be repeated frequently so that the movements will be learned. The patient always has to feel that his pelvis is corrected. The third correction of the pelvis was already shown in the beginning. Here the girls are performing the fourth correction of the pelvis. This is the turning of the pelvis around the vertical axis. At the same time, the hip below the hump of the ribs turns backwards, and the opposite hip turns to the front, without turning the trunk. The hand checks if the lumbar muscles are working, which were inactive until then. With the fifth pelvic correction, the pelvis below the hump of the ribs will be lowered. The floating ribs will be freed from pressure. The diaphragm can be lowered again. These pelvic corrections are also to be practiced during slow walking. The patient feels the relief in his concavities. He also feels that the air can flow more freely to those spots as he corrects his faulty balance and adopts a normal balance. The patients are taught the anatomical and physiological activity during the breathing process. They have to know that during the inspiration the diaphragm lowers itself and presses onto the bowels. During the conscious diaphragmatic breathing, the patient receives an impulse to straighten up, which he can actively continue right up to the back of the head. While studying this X-ray, the patient will be stimulated to copy it. With his own X-rays, it will be shown to him which sections of the ribs are not well ventilated and which have to be widened. as one can see, has the wrong one-sided breathing a twisting influence on the spine. Frequently with scoliosis there is also below the hump of the ribs a one-sided inactivity of the diaphragm. If it does not descend enough there, then the muscles which are there do not receive any impulses and they atrophy. A fold or a crease develops. The patient has to keep his X-ray always in mind. Yes, he must even imagine the one-sided activity of the diaphragm in his indented section of the trunk, and then exercise and feel this side to lift it up. The X-ray of this 44-year-old patient is turned in such a way as if the patient is lying on the left side, which is the concave side. The thoracic spine turns sharply to the right, which is here to the top. The concave ribs are narrowed. Here the patient is lying on the concave side. One recognizes how important this position is, because from this position the indented concave ribs can be lifted up. Through manual help, the patient obtains the feeling which he needs to help him to exercise what he imagines. These little pinches mean stimulation for breathing. The attention of the patient will be drawn to the affected side, which the patient has to fill through little intermittent sucking breathing exercises. It is attempted to overdo it, the so-called overcorrection, which the patient can picture for himself. From the front, the therapist blocks the so-called arch of the ribs in front, so that the inhaled air will be guided three-dimensionally into the right spot. In this case, caudal, cranial, and after that, dorsal. One can recognize clearly the intended leverage of the ribs, which is to unscrew the thoracic flexion. Even the contracted edge of the latissimus muscle stretches and extends again. The spine is straighter. By using the little correction pads under the body becomes derotated before the exercise begins. The bent legs are now in the so-called double screw position, so that the pelvis becomes the derotated fixed point. The indented frontal ribs, which are lying on top of each other, will be pulled to the outside with manual help. The patient helps from inside with special intermittent breathing, because the ribs lying on top of each other or behind each other force the hump of the ribs backwards. But it can be reduced only if the frontal locking will be removed. It is important that the lumbar side remains near the floor if possible. Actually, the last floating ribs belong functionally to the pelvis, which has to be turned to the rear on the side of the hump of the ribs. Also, the floating ribs have to be turned backwards on this side. Therefore, the knees are turned to the side of the hump of the ribs. The underlying pad of the most bent part of the hump of the ribs is causing the counter leverage of the hump to the front, which has to go into the awareness of the patient. This happening is actually outside the patient's awareness. With manual help and the control of mirrors, it is brought back to his memory. Before the exercise starts, it is necessary to widen the concave ribs so that they will be turned backwards from the pelvis and shoulder girdle. Through this derotating exercise, the oblique abdominal muscles will be corrected favorably. The following is turned: hip against the rib cage. The sniffing, intermittent breathing is clearly seen as the patient attempts to fill his lungs maximally. Here we use the stimulating touch on the contracted breast muscles. The ribs and the apex of the lungs, which are covered by the breast muscles, will be lifted and filled during breathing. This patient is standing with the trunk bent forwards. Firstly, the patient has to feel the maximal length by stretching with tiny sideways swinging movements, which have to pull up the head. Secondly, in this hanging position, the three-dimensional breathing follows in the concave side, sideways, upwards, and backwards. The controlling hand on the hump of the ribs indicates that this one is turning towards the front if the concave side turns towards the back. The same breathing technique is used in every other exercise doing different positions. It is important that the patient does not only exercise, but that he also can reproduce and stabilize the feeling at any time. In this way, the brain produces new patterns of movements, which will be used correctly in everyday movements. The same correcting breathing exercise as before on the rings. The most important part of each exercise is the maximal stretching. Only after having obtained the stretching is it possible to carry out the imagined right-angled breathing movements. The patient has to recognize that at the end, many of the useful and correct body movements will force a straight posture and an improvement of the appearance, mainly when the best results of the exercises will be stabilized during the expiration. The hand control on the side shows how much the ribs can move outwards if the breathing is guided. It is always important to use the torque, which moves the ribs backwards after widening them sideways and upwards. Once the breathing movements are patterned in the brain, the patient resists to do the wrong movements, even though he might be moving unconsciously, as he knows that the wrong movements will produce a deformity at the end. Therefore, he is forming positive patterns in the brain by using proper movements. An advanced patient feels precisely that the concave ribs, which have been widened by correct breathing, turn the corresponding vertebrae, pulling them to the middle and derotating them. This patient shows two so-called right angles in one breathing pattern. Firstly, the right floating ribs move sideways and upwards. Secondly, the left concave side moves sideways and upwards. It is a gentle, persuading work. This is a real and genuine deflection, without causing a worsening elsewhere. With other words, one has to start the deflection at the lowest arc, hence below the hump of the ribs. If the arch stands upright, the higher located arch is not needed for correction. These are the three correcting pads to derotate the trunk. which the patient places under the hip and under the shoulder blade of the concave side and under the apex of the hump of the ribs, in order to twist those parts to the front. Now the concave side, which is lying in between, is widened outwardly and spread upwardly. All is done with breathing, so that space will increase. After that, the ribs are turned backwards against the arch. During this, the head moves upwards in order to increase the extension. Only if the maximal extension is held can the derotation in the main flexion work. Torsional breathing on a chair. The patient has a right-sided thoracic convex idiopathic scoliosis. The left hip deviates to the outside, which again increases the right-sided hangover of the hump of the ribs. In order to derotate the pelvis while bending the trunk forward, a correction pad is placed under the right hip. The patient now turns his right chest to the front upwards and inwards. Everything is done in a stretching manner. Then follows the torsional breathing on the concave side, which should place the ribs backwards. The shoulder girdle on this side, however, must be brought forward, so that the right placing can occur. From the side view, to show the correction of the rib cage in front, to the left outer side and upwards and backwards. Those are the turning angle movements of the ribs. However, the shoulder girdle has to turn to the opposite side. The breathing is done by descending the diaphragm consciously.
Here one can see the directions of the turned angles on the convex side, namely to the front, upwards and inwards.
By doing this, the spine is shifted to the middle from the side of the hump of the ribs, whereas the ribs of the concave side are pulled over. While doing this correctly, the patient feels a turning in his main arch of the spine, which becomes stabilized with a strong muscle contraction during the expiration. At the end of the exercise, everything is practiced again while standing. In comparison with the previous one, the spine and the hips appear much straighter. Twisted leg seat. The leg below the hump of the ribs is straightened and rotated outwards and is guided backwards. The hip is stabilized on the back of the chair. Now one lowers the trunk to the front in extension of the leg, so that the trunk and the leg form one line. Also, from this favorable derotated position is the special twisted angle breathing carried out in different directions, which always has the aim to fill out the hollow places on the body and to flatten the higher ones. The concave sideline appears then convex. The side of the hump of the ribs appears now concave. This is a real deflection. The assistant indicates with slight strokes which parts of the body still require correction. One has to watch that the shoulders remain straight. Frequently, one pulls more with the left shoulder in order to widen the left ribs, but this increases the flexion in the cervical spine. if there is already one present or it starts to form one. In order to prevent this, it is necessary to widen the concavity above the hump of the ribs. This occurs by using the so-called counter pull of the shoulders. Counter pull of the shoulders. The patient has to sit strictly on the hump of the concave side and must also bend the trunk to this side. This is favorable for the widening of the ribs. The manual help is carried out in a twisting way with the torsional breathing principle, namely frontwards, upwards and inwards. A pure pressure against the side would be dangerous, as this would increase the already existing torsion. Therefore, it must be a grip which turns, lifts and pushes. Only when the hump of the ribs is turned frontwards, upwards and inwards, then this spot can be used as a fixed point for the counter pull of the shoulders. The small stroking movements of the hand help and support the development of the proprioception, which gradually develops. Development of the weak muscles below the hump of the ribs. A 16-year-old girl with a stiff thoracic scoliosis and a strongly overhanging hump of the ribs with muscles which below that point are atrophied. During the exercises, especially the inactive muscles below the hump of the ribs are put to work. These muscles now obtain a supporting function, that is, they are trained for length and force. The patient has to check with his hand frequently during the exercises if the desired muscles are actually working. In these, favorable starting positions are woven into the correction for the pelvis and the shoulder girdle, as well as the torsional angle breathing. Stretching the head up and out of the shoulder girdle, it stretches also the spine. As counterhold, it is necessary to use the push with the heel, which is the fifth correction of the pelvis. All these corrections are done with a conscious, slowly carried out diaphragmatic breathing and an all-round tension of all muscles, which then perfect the whole exercise. For patients with a right-sided convex thoracic scoliosis, there is always placed a correction pad under the right hip, which derotates the pelvis passively. The patient has to remember the twisted feeling. The therapist sees the back of the patient in a mirror, back to front. With this, he receives important aid for his correction, because often the eye becomes used to the wrong form of the one who exercises. But in the mirror, he notices the wrong form especially, as they appear back to front to him. With slight manual strokes in the concave parts of the thorax, it becomes clear to the one who exercises to which part his breath has to flow. He uses little side-swinging, elongating movements with the imagination that by doing this, his intervertebral spaces on the concave side would widen. At the end of such a forming exercise, the correct result is always stabilized in this way that the patient uses a correcting isometric muscle tension all around during the expiration. The therapist can only teach, explain, show and help, but to practice has the patient himself. The highest physical, mental and emotional activities are developed and demanded, which help the patient to mature his personality. If a patient knows why certain exercises are asked of him, then he is willing to go to his uttermost exercise limit, and only then can muscle growth, and with this a correction of the scoliotic deformed body, occur.